Hi guys, how are you doing? I hope you are doing well, and welcome to today's episode of learning. Uh, in the previous lesson, we learned about um, high blood pressure in pregnancy, and we learned that it is a life-threatening condition. So today I want us to talk about high blood pressure and how it affects your baby. Okay, so I told you that high blood pressure has a medical term called preeclampsia, and we learned that if high blood pressures are not well controlled, they can progress to a complication called eclampsia. And so today I want us to learn about eclampsia and your baby. That means dangerously high blood pressures and how they affect your baby and what is supposed to be done. Okay, so eclampsia means your blood pressures are very high, and most of the time it is uncontrollable. So it is a severe complication of preeclampsia. Okay, when high blood pressure results to seizures, that means your uncontrollable high blood pressures results to leads to convulsions, and a mother goes into convulsing. Okay, and during this period of convulsions, there is an alteration in blood pressure and also oxygen supply to the placenta, and that is dangerous and also life-threatening to the unborn baby. So this harms the fetus, okay, the unborn baby, because their brain is has not matured, okay. So and it is so sensitive to abnormal experiences like convulsions. So it can lead to death, okay, of the baby. So high blood pressures affect the placenta. Okay, it affects the placenta, and as you understand, the placenta is responsible. It delivers oxygen and nutrients to the unborn baby. Okay, so when your blood pressure is high, it affects the arteries carrying blood to the placenta. Okay, it reduces blood flow to the placenta, and by reducing blood flow, that means your baby will not receive adequate nutrients and also oxygen. Okay, and this one, okay, high blood pressure affects blood flow to the placenta. Okay, um, in such a way that it reduces blood flow to the placenta. Okay, and the baby that you are carrying, you supply nutrients and also oxygen to it through the placenta, and this one is carried in your blood. And so if blood flow to the placenta is reduced, that means your baby will not receive enough oxygen and also nutrients. How will this affect the baby? Number one, there will be a slow growth rate. Why? Because it's not receiving enough nutrients. So, slow growth rate. Number two, your baby will have a low birth weight because it's not receiving enough nutrients. Number three, you can have a preterm birth. That means you will give birth to the baby when it's not mature. Why? Because when you have high blood pressure, it is life-threatening to you and the baby. So your doctor can induce labor, or you might go into an emergency CS. That means you will give birth to a preterm baby because before the baby is term. We also have placenta abruption. When you have high blood pressure, this can lead to placenta detaching from the uterine wall, and this will lead to severe hemorrhage, severe bleeding, and this can lead to the baby dying and also the mother. In this case, your doctor will take you for an emergency CS to save you and also the baby. You also have stillbirth, okay, giving birth to a baby who is dead. Okay, so what is the treatment of eclampsia? What is the treatment of very high blood pressures during pregnancy? The treatment is delivering the baby and also the placenta. Okay, so your doctor will consider taking you for an emergency CS to deliver your baby and also the placenta. And this is determined by the maturity of the baby, because preterm babies have issues because their lungs have not developed, so they always develop issues with breathing. So your doctor will see how to manage your baby until he can be able to breathe well. So delivering your baby is determined by the severity of the disease and also the maturity of your baby. The doctor will try as much as possible to reduce your blood pressures, but if they are not controllable at all, you will go for an emergency CS to deliver your baby and also the placenta. If your baby is not mature enough, he will be taken to an NBU, okay, where he will get specialized care. Okay, so yeah, that is it for eclampsia and your baby. You have seen that it can lead to the death of the baby. So your doctor will deliver your baby depending on the maturity. If the baby needs specialized care, they will be taken to a neonatal unit where they will get specialized care. Okay, thank you so much for watching. Continue subscribing. If you have any question, ask me down there in the comment section. I will try my level best to answer you. Thank you.